I'm going to start with Taylor by introducing yourself, please. And you just muted, but
oh, yeah,
unmute.
yeah. Hi, everyone. My name's Taylor. I am a third-year PhD student in the clinical psych program here at Rutgers, and I've been working at the GVRC for a couple years now, and I'm super excited to chat with you guys about a paper we published recently. So, Allie, do you want to introduce yourself?
Please. Yeah, absolutely. Mine sounds a whole lot like Taylor's. I'm also a third-year PhD clinical psychology student working in the GVRC with Dr. Mike Anestis. And I am also presenting on a paper we recently published, but it is a different paper than Taylor's, don't worry.
And then, hi everyone, my name is Jordan Costa. I'm a fourth-year PhD candidate in the School of Criminal Justice at Rutgers Newark, where I mainly study community trauma and structural violence, as well as violence reduction strategies. I will be going first today, so I won't tell you about my paper until Patrice has formally handed it over to me.
And that I have.
Okay, great. Okay, let me share my slides then. Okay, can we see that?
Yep, it looks good.
That looks good.
Great. Great. So again, good afternoon, everyone. Thank you for coming to our breakout group to hear more about the work that we doctoral researchers are doing here at the New Jersey Gun Violence Research Center. Today, I'm going to be talking to you about a project I'm actively working on centered on credible messengers called From Survivor to Savior, examining the role of credible messengers in the provision of trauma-informed care. I want to preface this presentation by saying that this study is very much a work in progress and has not gone according to plan given the interruption of COVID and other factors. So if you have any feedback you'd like to provide at the end of the presentation or privately over email, I welcome it. So to level set the conversation, I'm just going to start off by giving some context about community violence work and credible messengers specifically, because these words can mean different things to different people, and I want to make sure that we're all on the same page with respect to what I mean when I reference these workers. Then we'll move to the objectives of the current study, the methodology I'm using, and the current state of the work. So to start off, what is a credible messenger? You may have heard this term interchanged with others like violence interrupters, peacemakers, violence intervention specialists, and in some ways they may overlap. However, for the purpose of this study, I define credible messengers as individuals who they themselves have experienced a violent injury, specifically a gunshot wound or stab wound, and serve their community in a role that functions to interrupt the cycle of violence. Just as an aside, my personal background is in hospital-based violence intervention programs and providing direct services in that context, actually under the leadership of one of our keynote speakers, Dr. Richardson. And initially, I wanted to keep this study focused on that environment, but in an effort to introduce sources of variation and capture a broader audience of credible messengers, I decided to also include individuals who work in faith-based violence prevention programs, street outreach, and nonprofit work. So we covered what I mean by credible messenger. Now, where do they come from? Well, we know that historically our society has leaned towards more punitive ways of addressing violence, which can be seen in tough on crime policies, over-policing, mass incarceration, and other band-aid fixes that arguably cause more harm and trauma than they prevent. Unfortunately, many people with decision-making power are a few degrees of freedom away from the issue of violence, and the community suffers from this uninformed and disconnected relationship. And this is an issue because solutions are in the community. Those closest to the problem are those closest to the solution. In fact, the first mentions of the term credible messengers have roots in the Black Panther Party, and at their core embody a resistance to the way systems of oppression were addressing violence and empowering community members to take matters into their own hands to see the reductions they wanted. Now, this hasn't always been warmly embraced by systems, but this is to say that this isn't new and that these efforts have been here for decades. And I'm really happy that the Newark Community Street team is highlighted today because they're a perfect example. Credible messengers are those who have lived experience with violence and want to use that lived experience to help their peers, but more often younger generations circumvent the trials and tribulations that they or those they know had to endure to encourage alternatives and or encourage alternatives to potentially fatal paths producers and victims of violence might be going down. So this credibility and wisdom puts credible messengers in a unique position to connect with people who are difficult to reach, which is at the core of community safety. So why is this important? Well, we're starting to hear a lot more about credible messengers and violence interrupters, outreach workers, peacemakers, And programs often leverage them as pillars of their operations, but we actually don't know a whole lot about them. However, what we do know is that they're not supported adequately enough for the work that they do and the amount of trauma that they're exposed to while doing the work. I actually just got back from Kansas City a few days ago for another project I'm a part of to interview some frontline workers about trauma exposure in their work, and it was really powerful. Sadly, little research has really done a landscape scan on this, with the exception of a report by Giffords called On the Front Lines, which looked at outreach workers in LA, Chicago, Oakland, and Baltimore, and the recent work of Andy Papachristos within the last year at Chicago called Views, where he and his team interviewed over 90% of all outreach workers in Chicago to learn more about their lived experiences. And it's important that these studies get replicated across the country in different regions so that we can better understand the workers, their backgrounds, their work-life balance, their motivations for joining the work, their exposure to trauma, among other factors, so that as these programs expand in communities and as federal dollars start moving within states, the well-being and working conditions of workers are prioritized and valued. So that leads us to where we are now in my current study. The paper is exploratory in nature because we really are at square one, where those of us who have been on the ground and networked with people on the ground know some anecdotal information, but the empirical base is just not there, and we need to build it. So this study has two objectives. One, to understand the backgrounds and lived experiences of credible messengers, as well as motivations for joining the work. And two, to assess structural supports offered to credible messengers to mitigate exposure to trauma. And I really want to emphasize the second objective here for a moment, because this work is contingent upon an individual having experienced great trauma and then using that trauma to provide trauma-informed care to reduce harm and violence. So as long as the work necessitates traumatic experiences to qualify for the job, we need to make sure that programs are offering the appropriate supports to ensure that we're not burning out workers or contributing to vicarious trauma without trying to mitigate it, and responding to the needs of those doing the groundwork that many people with decision-making power will never be privy to. I will add that in some forms of the word credible messenger, the individual doesn't have to be violently injured. And I think that would be interesting to explore and do a comparative analysis of at a later time with a broader research scope. But right now I'm interested in those who have experienced violent injury and how that plays a role in what brings them to the work and how they do it. So this study is survey-based. I designed a survey tool that looks at these demographic questions, asks about what type of program a credible messenger is affiliated with. I ask about compensation, mental health supports, motivations for joining the work, how long after their own violent injury did they choose to join the work, reasons they might have left the work or considered leaving, to get a better understanding of the people we're looking to support. I also incorporated an interview component to get some more granular anecdotal data about what it's like to be a credible messenger, because I think surveys don't always capture the depth of the work, but this part is optional. Participants are asked if they would like to participate in an interview, but it's not a requirement of participating in the study, and all participants are compensated for their time. So here you can see the survey questions that participants are presented with. You can see participants are screened for eligibility upon opening the survey in Qualtrics. If they're eligible, they move on to answering some background questions about their violent injuries and possible incarcerations. A reminder that this is not a requirement to have been incarcerated, but it is a requirement to have been violently injured for the study. I ask about how long they've been in the work and how many participants they've enrolled in their program since starting. And then move on to a section about working conditions. What kind of program are they in? How do they get compensated? Do they think they're underpaid, overpaid, fairly paid? What's their access to mental health resources like? Have they ever wanted to leave, and why? Do they leave, or did they leave, and why? And why do they stay? And then some demographic questions at the end. So finally, to wrap up, because I know we're coming up on my time, what is the current state of the work? Right now, I'm still in the recruitment phase. Initially, I wanted to just focus on New Jersey credible messengers, but the sample that I was working with was so small that I worried about jeopardizing anonymity. So I've decided to expand out a bit more on the East Coast, mainly New Jersey, Pennsylvania, New York, Maryland, and DC, to capture a broader group of credible messengers that will hopefully lead to richer data and more confidentiality protections, as these are states with a number of programs that leverage these workers. I also wanted to include those who are past and present credible messengers to cast a wider net, and potentially get some more information about attrition in the work, since none of the studies I mentioned earlier talk about why people choose to leave the work. And I think this piece is important, because if the answer to why they choose to leave is because they're getting traumatized, then I think that gives programs pause, that should give programs pause and generate a time for reflection, so that they're working to not contribute to the reproduction of trauma. The next step is to analyze the descriptive data through a content analysis and generate some themes. And then ideally, I would like to create some type of report to provide participating programs and jurisdictions with that could inform more equitable and trauma-informed care of credible messengers as they work to reduce violence in their communities, with the goal that this translates into some type of tangible support system at the structural level. So thank you for taking the time to listen to my presentation. I'm happy to answer any questions at the end of the session or via email, which is up on the screen. And I will pass it to Taylor.
Thanks, Jordan. Allie's going to share my slides for me because I perpetually have issues with my slide sharing. So she's just going to get that going. Thank you, Allie. Hi, so my name's Taylor, and today I'm going to be talking about a paper where we're looking at dispositional characteristics, or in other words, personality traits, and how they relate to firearm ownership and purchasing behavior, specifically during the unprecedented surge in firearm sales during 2020. So we looked at two traits specifically, and the first of those is threat sensitivity, and we can define this as kind of a general disposition or tendency to be more or less sensitive to threats. So someone with low threat sensitivity is going to be on that kind of blue end of that thermometer when they're faced with a threat or some sort of fear. And so we would kind of expect them to approach high-risk objects like firearms, for instance, with a low amount of fear. And so someone with low threat sensitivity probably has more comfort with firearms and other high-risk objects. But someone with low threat sensitivity also would not be expected to increase a behavior in response to a perceived threat because they're not as sensitive to that fear or as sensitive to a threat. So we don't really expect them to change a behavior in response to that. So for things when we're thinking about like firearm purchasing during the surge, they probably aren't purchasing more firearms in this kind of heightened stress time like the surge in 2020. So the other trait we looked at was disinhibition. And this trait is defined as kind of the general disposition or tendency to be more impulsive and have less control over emotions. So when we think of someone with high disinhibition, we would expect them to also have kind of this affinity towards high-risk objects, kind of some level of comfort with high-risk objects like firearms. And at the same time, we would expect this individual to have higher anxiety and a little bit stronger emotional reactions to things. And so we might expect someone with high disinhibition to increase a behavior in response to a fear or an emotion. So we would expect someone with high disinhibition to maybe purchase firearms during a threat-sensitive time, such as 2020 was. So that leads us into our current study, where we were essentially looking at what these traits looked like in relation to firearm ownership, surge purchasing, and plans to purchase. So specifically for the firearm ownership piece, we just compared firearm owners and non-firearm owners and expected to see lower threat sensitivity for firearm owners and higher disinhibition. For the surge purchasing, we compared people who did not own a firearm, people who bought a firearm during the surge, and people who own firearms but did not purchase during the surge. And so across those groups, we expected those who purchased during the surge not to have a difference in threat sensitivity, but to have higher disinhibition. Similarly, for plans to purchase, we had three groups. So we looked at those with no plans to purchase, those who were undecided about whether or not they had plans to purchase, and those who did have plans to purchase. And so that was within the next year. So they said, yeah, in the next year, I probably will acquire a firearm. And so we expected those individuals to also not have a difference with threat sensitivity, but to have higher disinhibition. So for our sample, we had 3,500 adults demographically matched the 2010 US Census data. So you can see those demographics here. We had about 32% of these individuals identify as firearm owners, and everyone completed self-report questionnaires between late June and early July 2020. So as far as our results go, I just wanted to give an overview of these things, and I'm happy to answer questions at the end if we have time, or you can reach out to me if you have more questions about this. But generally what we found was that firearm owners did have higher impulsive tendencies and less emotion regulation and less dispositional fear than the non-firearm owning group. Then when we're thinking about our surge purchasers and those who did have plans to purchase in the next year, we saw that they had higher impulsive tendencies and less emotion regulation. And then for those who did not purchase a firearm during the 2020 surge, but they were firearm owners but didn't purchase during the surge, they had less dispositional fear. And I wanted to point out that our mean differences for threat sensitivity, thanks, Allie. The mean differences for threat sensitivity, so that dispositional fear piece, were smaller than what we saw for the differences in disinhibition. So that kind of points to a stronger role of that distress regulation or impulsivity, as opposed to that threat sensitivity or fear-based decision-making when we're thinking about firearm planning and purchasing during 2020. So quickly, I wanted to offer up some discussion points about this. We know from other research that firearm acquisition is related to an increased expectancy of threat and increased feelings of safety. And it's possible that our results are kind of reflecting a similar pattern there, where maybe firearm owners are already a little bit more hyper-vigilant. They're already paying attention to threats and maybe have a little bit more anxiety about things, feelings of fear, threats that could be coming up. And so they may be scoring on higher disinhibition because of that. On the other hand of this, it's possible that individuals with higher disinhibition who are already kind of prone to being a little bit more on that anxious level, a little bit more distressed, maybe they're purchasing firearms to feel safer and to bring themselves a sense of security. And this is something that has come up a lot, I think, in our keynotes today, this idea that, firearms do help people feel secure and oftentimes are for safety. And so that could be another reason we're kind of seeing this pattern of results. I do want to point out, though, that we can't really say, based off my results, what the directionality is here. So we have to have more research to kind of parse that apart in the future. And then as far as the threat sensitivity piece goes, we know that individuals with low threat sensitivity make less fear or emotion-based decisions. And so that might be why we're not seeing as much surge purchasing with these individuals, where they're not feeling kind of that need to respond to a fear or anything like that. And on the other end of this, firearm owners, again, might already have that kind of increased safety or some level of fearlessness because of their ownership. And so maybe they don't feel as driven to purchase during that surge. And subsequently are showing up on that lower threat sensitivity end. So as I mentioned, there are some limitations to this. We only looked at this within one time point. So again, that directionality piece is not really answerable with this data. So in the future, using kind of more longitudinal data and looking at these kind of traits outside of the context of our contentious 2020 time period will be important. And then also we use pretty brief self-report measures. And so using other measures of personality and decision-making can be pretty helpful here as well. But overall, this study is pretty preliminary in nature. And when we're thinking about our implications, we do need further research, but generally, and Allie, you can go to the next slide for me. I appreciate it. Generally, the study kind of helps us understand how personality might manifest during fearful and contentious times. And it also might point to kind of helping us understand firearm owners to eventually help kind of inform programs and interventions. The idea here is that by knowing who we're talking to when we're promoting firearm safety, we can kind of better tailor our efforts to increase behavior change. And I think this really fits in with a lot of the things we've talked about here at the GVRC as far as understanding, what messages for whom are effective in increasing safe firearm behaviors, and kind of adding in personality and these kind of traits that drive decisions and make up who we are outside of our demographics can be a really important piece of that puzzle of knowing who is purchasing firearms, why they might be purchasing firearms, and how we can best speak to them moving forward. So with that, I'm going to stop here for my time and transition things over to Allie, and then we'll have some time at the end for questions, hopefully. So thank you.
Awesome. Thanks, Taylor. So give me 1 second, guys, while I end Taylor's and begin mine, and we will keep rolling. So I'm going to share my screen, and we're going to hope technology keeps working for us. All right. I can't see you guys. So Taylor or Jordan, you guys see that one?
You're good.
Yep,
Awesome.
you're good.
Perfect. Thanks, guys. So hi, I'm Allie. I'm a third-year PhD student in clinical psychology, working here at the GVRC. I'm presenting on a paper we published recently looking at mental health treatment seeking and history of suicidal thoughts among suicide decedents by mechanism. And when we say mechanism, we just mean different methods. So firearm, hanging, overdose, different mechanisms or methods like that. So we've talked a lot about background today, so I'm going to kind of fly through this slide, but overall suicide rates are increasing pretty steadily here in the US, even though they're decreasing in the rest of the world. Our understanding of risk factors for suicide is really low. Actually, a meta-analysis that came out in 2017 showed we're no better at predicting suicide than we were 50 years ago. So to me, that really says, all right, we got to do something different. We really need an alternate approach to suicide prevention. And given that firearms are accounting for over 50% of all suicide deaths and are the most lethal method, firearms need to be a focus for suicide prevention, and mean safety might be one avenue to reduce suicide. Now, when we talk about mean safety, we mean making a method for suicide less lethal or less readily available by limiting this quick and ready access to that method. So this has been shown to be really effective for highly lethal and highly available methods in other countries. So, back a few decades ago, domestic gas was a commonly used method for suicide in the UK. They put bans around certain types of domestic gas and saw a reduction in suicide rates. Same things with pesticides in Sri Lanka. And then bringing it kind of to a firearms example, the Israeli Defense Force saw a 40% reduction in young service members' suicide rates when they instituted a policy that did not allow them to take their firearms with them on leave. And so kind of in line with this, research has shown that unsafe firearm storage, so storing a firearm loaded and unlocked, increases risk for suicide, while safe firearm storage, unloaded, locked, separate from ammunition, decreases risk for suicide. So firearm mean safety might be effective for reducing suicides here in the US. But in order to make mean safety effective and ensure firearm mean safety strategies are being distributed to the right people, we need to have a better understanding of who's using a firearm in their suicide death. So far, research has looked at different demographic factors, like we know men are more likely to use a firearm than women, but we haven't looked at some of these other factors, right? Like being in treatment. So currently in treatment, lifetime treatment, or previously having disclosed thoughts of suicide or previously having attempted suicide, and how those might differentiate those who choose to use a firearm in their suicide death from those who choose to use another method. So that brings us to the present study. So we examined if treatment seeking, previous suicidal thoughts, and previous suicide attempts and behaviors differentiate those who die by suicide with a firearm versus those who died by suicide with another method. Then we said, all right, let's break it down a little bit more. And we explored if these differences hold when we compare those who died by firearm to those who died by hanging and those who died by poisoning. Those are the two methods we chose because hanging is the second most lethal method with about a 78% fatality rate, and poisoning has about a 3% fatality rate. So it's one of the lowest lethal methods, but it's actually the most commonly used in attempts. So I broke down the variables because I know I'm talking real fast and we're kind of flying through these, but I want to just remind everyone, these are what we're looking at in the present study. Do those who use a firearm differ from those who use another method on being in treatment when they died, ever being in treatment, having thoughts of suicide or suicidal ideation, previously attempting suicide, or telling other people about their thoughts or plan for suicide in the month prior to their death? Table's got a lot of info on it, but we're just going to break it down a little bit. We use the National Violent Death Reporting System. So this is a big data set that has every violent death that occurs in 32 states here in the US, and it's organized and monitored by the CDC. Put in a short plug, it's like you can submit an application and get data. It's such a rich data set, and I think it's just one of those that not a lot of folks know about, so I highly recommend kind of checking out NVDRS. We used a subsample of those from the data set by looking at only those who died by suicide from 2003 to 2018. As you can see, we had actually a pretty big sample with over 230,000 folks, and about half died by suicide. This table breaks it down by the total sample and then the different types of mechanisms, firearms, hanging, and poisoning. But overall, the total sample, most people were male and most were white. So let's jump into the results so we have some time to chat about them. So suicide decedents who were in treatment at the time of their death, had ever been in treatment, or had previously had thoughts of suicide before their death were significantly less likely to use a firearm. These two groups, so those who used a firearm and those who used another method, did not differ on previous attempts, but suicide decedents who disclosed thoughts or a plan of suicide in the month prior to their death were significantly more likely to use a firearm. Now you can see my little traffic cones there. I want us to be really careful with our interpretation of this. So we looked at this and we were kind of surprised by that. And we looked at the percentages and they were actually super close. So we said, is something wonky going on here in the model? So we pulled it out and we ran a regression just with past month among those who used a firearm versus other methods. And we found that the results don't hold. So I want us to be really careful. It's not that everyone who's using a firearm is disclosing, but it's just something that we're kind of seeing as like, could this be a difference? And even if it's not a difference, it's something we just want to note that there is a percentage that are disclosing their thoughts of suicide in the month prior to their death. So when we look at those who use a firearm compared to those who use a hanging, we see pretty similar results, except there's no difference in currently being in treatment for a mental health or substance use condition. And again, I want us to be careful with that last finding. And then those who used a firearm versus those who died by poisoning, again, very similar results, except those who died by suicide with a firearm were actually more likely to have previous history of suicidal thoughts and plans compared to those who died by poisoning. So I just threw a whole lot at you in a pretty short amount of time. So let's recap real quick. And then I just want to chat about discussion and leave some time for questions if we can. So as a reminder, we wanted to see if there were differences in mental health and substance use treatment and previous suicidality among those who used a firearm compared to another method. Overall, we saw really low rates of treatment seeking and previous suicidality among suicide decedents. So every one of those variables, less than half the sample engaged in treatment or had previous thoughts of suicide or previous attempts. I think the highest was 44% were a lifetime in treatment for those who died by poisoning. So still not many folks are coming through our doors as psychologists or even physicians, right? They're not really in treatment much. Talking about firearms, so we know that those who died by firearms came into contact with health services less, both because they're not seeking treatment and they're less likely to kind of have some of these suicidal thoughts. However, those who died by another method came into contact with mental health services more, but everyone in this sample died by suicide. So that also needs to be addressed, right? Even folks who are kind of coming through our doors are still wind up dying by suicide. So let's try out some discussion points. So we found that those who died by suicide were less likely to be in treatment than those who used another method. However, we commonly task physicians and healthcare professionals with discussing firearm safety for suicide prevention. But if firearm owners aren't coming in to see them and then are dying by suicide, then the message is kind of not being delivered to the group we really need it to be delivered to. Also, Taylor gave a little sneak peek of some studies we have being done with credible messengers. And we know that firearm owners see law enforcement, current military, veterans, and family as highly credible, and they actually rate physicians as really low credible. So I think that speaks to the fact that we need to really get training on firearm immune safety and different strategies like safe storage maps for getting firearms outside the home to the community and to these family members. Again, being in treatment and disclosure of thoughts was pretty low. However, about 23% of the sample did disclose their thoughts of suicide to someone in the month prior to their death. Again, talking about this need for upstream or population level interventions for suicide prevention. And then some future directions, I think we need to know who they're disclosing to, right? This who, what, when, where, how, like what's happening with this disclosure and how can we support those who are getting this information, right? They're hearing somebody is thinking about or planning suicide. And then we need more research on credible sources. We know who people think that they think are credible, but now we want to know, are they actually credible? Do they actually impact behavior change? And then scalable means safety, training, and implementation. So I know I went through that really fast. The cool thing is, thank you to the GVRC for making this paper open access. So you can scan this QR code and get right to the paper, no crazy paywalls, no journal fees, none of that. So just awesome of the GVRC to make sure that this is accessible. I'm going to take one more minute of our time and just pop this graphic up really quickly. This is something that our colleague Shelby Vandal, who couldn't be here today, worked on. It's a paper looking at public perceptions of gun violence related headlines. This is on the GVRC's Twitter. I highly recommend just taking a look at it. She had some super interesting findings. And with that, I think we're like 1 minute over, but we tried to talk real fast.
Well, you did good. Either way, all three of you guys, I'm so proud of you, and we cannot even express how thankful we are. But I am just going to go over this one question for Taylor. Are you able to associate political affiliation with threat sensitivity? What other factors seem relevant?
Yeah, I appreciate the question. We weren't able to look at it for this study, but I do think that it's something to consider, especially with the political climate that was going on in 2020. When we talk about these traits, we know they're global and across different situations. And at the same time, the manifestation of those traits can look differently based off of different situations. So it might look different for certain political affiliations or like what's going on in the political parties at the time and things like that. So I do think it's definitely relevant, and I didn't have the data at the time, but something to kind of keep in mind as we're moving forward in our research.
Okay, and just so that everybody knows, we are going to conclude all the sessions. And again, we thank everybody who joined us. Don't leave as yet. We are encouraging everybody to go back to the stage, either on your left or right side where it says stage and it says live. Click that and you will see some closing remark conversation from our executive director, Dr. Micah Nestes. And again, thanks to the GVRC team. We appreciate you guys.
Thanks, Patrice.
Thank you all.
You're welcome. Take care.